We're pleased to have you with us today for Public Health Policymaking Part 2, Assessing Policy Action. Hi, everyone. I'm Renee Parks, Research Project Manager with the Prevention Research Center at Washington University in St. Louis. I'll be your host and presenter, but I would say more facilitator for this workshop. This is the second workshop in the series, Community Health Through Policy Change. The series is part of a multi-year project funded by the Centers for Disease Control and Prevention with the overall goal to develop and share strategies to increase the use of effective policies to reduce health disparities. Our center has the privilege of collaborating with several community health coalitions. Many of you are members of them, and we've been learning about your communities, your networks, the connections that you have with one another, your health goals and priorities, and really with the intent of providing some technical assistance to advance your efforts in improving community health through effective evidence-based policy action. All right, so Masame and I are the dynamic duo behind this workshop, making it possible. Let me call in my wonderful colleague, Masame Fagintani.
Hello, everybody. Welcome to this workshop. I'm so glad that to meet you here. And I'm working with Renee and Dr. Branson here at WashU. I'm EVPH student and also research assistant at Prevention Research Center. Nice to meet you here.
Thanks, Masame. Masame is going to be behind the scenes. She's going to be handling the chat and the breakout rooms and handling any troubleshooting. So feel free to drop any issues in the chat, and she'll alert me, and we'll do our best to move us along through this workshop. All right, so our learning objectives for this workshop. Well, I am hoping that you become familiar or gain greater familiarity with resources for public health reviews of policy actions, as well as some policy options. Discuss key questions and prioritization criteria that can be used to assess policy options, and then discuss strategy for adoption of the policy. This workshop, as well as the last one, is really grounded in evidence-based public health, or the EVPH Framework, which is developed by Dr. Ross Brownson and colleagues. As I mentioned previously, and I'll mention now, EVPH really involves engaging the community in assessment and decision-making. You're applying planning and quality improvement frameworks, adapting and implementing evidence-based interventions for specific populations or settings, conducting sound evaluation and dissemination of evaluation findings to improve programs and policies. It's a whole mouthful, but really it's kind of that art and science, and really the community is right alongside throughout the entire process. In the last workshop, we focused on identifying and defining the issue. And so we covered concepts from the red, orange, and yellow segments of the wheel that's pictured in front of you. Today, we're going to talk about elements from the green and the darker blue. So kind of scanning the scientific literature and how to really analyze and prioritize the policy options. This workshop is grounded in the CDC's policy process framework, specifically the portion on the policy analytical framework. There's a great deal of overlap between this and the EVPH framework. And today's workshop, as I've already mentioned, will be on policy analysis. And with that, we're also going to talk about strategy for development and adoption of the policy solution. Okay, so wanted to begin the workshop with some grounding in definitions and just kind of public health frameworks. So Some of this is a repeat from the last workshop, but these are key elements that I'm going to talk about, and I'm going to probably cover them pretty quickly, but wanting to make sure that we're all on the same page about what a policy is. Policy is a law, regulation, procedure, administrative action, incentive, or a voluntary practice of governments and other institutions. Policy has been a common state in public health, and I think sometimes it gets lost, which is all that we're doing in public health. But I mentioned in the last workshop a couple like commonplace policies that are a core part of just our society. I just think automatically, I think tobacco control, that's kind of been ingrained in our society. And some of those policies have included increasing tobacco prices, the tax, and also creating tobacco-free areas and communities to protect the community from the effects of secondhand tobacco exposure. But also I think of injury prevention with seatbelt laws and laws mandating the use of child safety seats. So those are kind of the commonplace ones, but there's many other examples. Just a quick nod to some types of policies. These are kind of the three big commonplace policy types: organizational policies, which establish guidelines for how potential issues and business decisions are managed. They align the organization's vision and values with day-to-day operations. And some of those examples include employee conduct policies, dress code, attendance policies. Public policies are defined by government, consists of laws, ordinances, resolutions, and orders. And then the final type, the regulatory policies or regulations, which are sometimes known as rules. These really help government carry out public policy. It's a law that's created by an administrative agency, and regulations differ from legislation in that they are not voted on by legislative bodies like the County Board of Supervisors or a city council. They're, again, carried out, created by an administrative agency, and they really help to fill in the details of legislation. Okay. So a lot of you may be familiar with some version of the social ecological model or framework. This one has 5 levels, and it really illustrates and emphasizes that health is determined by multiple influences at multiple levels. So, you know, if we're peeling back the onion or looking at it, starting in the core with the individual level, which, or the intrapersonal here as it's on the visual, which is getting at knowledge, beliefs, attitudes, skills, but how that is influenced by the interpersonal and and this is going back and forth. So the individual is being impacted by the interpersonal, the institutional, the community level, public policy, and those layers or levels are influencing all the other levels. And it really just kind of illustrates, shows us that most effective policy, or excuse me, most effective public health operate at multiple levels. And we must take policy into account because really policy is driving all those other layers. It's driving everything. Okay, there is a lot going on with this, this framework. This comes to us from the Bay Area Regional Health Inequities Initiative. And I just want to point out some things. So just to get you oriented, there's this spectrum, right, that's running along the top. And you can see over to the right, it says downstream, and then to the left, it's more upstream. And there's a similar one, and you can read that below, but I just want to point out. So, you know, again, there's a lot going on, but health or health outcomes are really strongly influenced by the social and environmental conditions. And you can see with the downstream and that medical model really focuses on preventing premature death by treating and managing disease and injury. And that's the product of, you know, factors and risk behaviors like smoking, poor diet, and lack of physical activity or exercise. It's really grounded in the assumption that individuals are making independent behavioral choices from a broad array of options, some healthy, some not. So you can see that. And then we think about the upstream, and I guess it's really worth noting how, you know, things like living conditions, physical environment, the economic and work environment, the social environment, the service environment, these things are impacting those downstream items. And of course, living conditions outlined here are impacted by institutional inequities and social inequities. And this is really the policy arena. So, you know, upstream, if we are facing inequities, which we have, that's creating downstream disparity. And really upstream, the social ecological model, which we kind of just briefly talked about, really recognizes that social inequities are the legacy of past and current policy, and that, you know, as public health and community health practitioners, we really must engage in policy, and we really must be advancing conditions and the environment and addressing inequities in order to really address health disparities, advance health equity, which will improve community health. All right, and so as I mentioned, health equity, again, wanting to ensure that we're all on the same page, and I know this is very much, as I scan, you know, your roles, your positions, and your organizations. We all have a part to play in addressing health equity, and you know, when we talk about health equity, sure, the definition is really simple: giving everyone a fair opportunity for health. I think we all know that doing that is not so simple. And really, there's been a lot of things historically that have impeded this, and a lot of challenges in the systems that we have in place. And our work is ongoing, and we're continuing to learn and grow. I like this visual because I think it really does a fine job of capturing the difference between quality and equity, and recognizing that giving everyone the same thing is not really actually cutting it. It's not really meeting their needs. So the understanding that equity is really recognizing the barriers, the inequities that may be in place, and tailoring and ensuring a good fit to meet the needs. And then I wanted to include this visual that's actually from some work led by a colleague here at the Prevention Research Center, Steph Mazuka. She and the team really outlined pretty well in this visual that when we're looking at community health and chronic disease prevention, we need to recognize that it's happening and is absolutely needed to happen at all these different sectors. All of these sectors must be involved in carrying out evidence-based policies and interventions to impact the community. And some of these sectors, these areas, education, city planning and transportation, parks and recreation, faith-based organizations, these are not necessarily traditional health spaces or medical spaces. So really having coordination, coalitions like you all have to help understand the piece of the puzzle to advance community health and health equity is really needed to improve health disparities. And then I wanted to include this table. I included it last time as well, really emphasizing action at the local level is really instrumental in improving health and reducing disparities. And those collaborations and collective action really at the local level, it's so important. Many drivers of health can be influenced through decisions about how local programs and services are delivered. Local governments have control over a lot of these programs and services, from housing to education to transportation to even healthcare, which really provide opportunities to make the changes that touch people directly. Local policy is more likely to be grounded in that real understanding of the community's needs, the health needs, the goals, and lived experiences of residents, and therefore more likely to create that lasting change. Local governments are labs for policy change. They can really provide case studies and evidence of success, which can really be instrumental for other jurisdictions, other local governments to adopt and really set the stage for state and national changes in the future. And then local policy change, a lot of times can just be more feasible than policy change at state and federal levels. And so I included this to kind of just to have like the various local entities and some of the health related areas in which they have authority. This table I actually adapted a little, but it's from Jamie Foster, who's a Connecticut state representative and a research scientist at Yale Griffin Prevention Research Center. Okay, so in the previous webinar defining the issue, really we covered like developing an issue statement, or those key criteria, or key components of an issue statement were discussed, really except for number 4. So that's what we're going to dive into today, solutions being considered, and we're really going to think through and analyze as well as prioritize policy options and solutions. Okay, so policy analysis, there's 2 parts to it. We want to identify and describe policy options, and then we want to prioritize them. And really success of evidence-based public health rests largely on the ability to find credible, high quality evidence. We have, really great information technologies. They exist for finding really great, valuable evidence quickly and efficiently. And this evidence that I'm referring to, think of like evidence falls in many, like it's data, it's information, it's connecting with community. But evidence is often obtained from searching and reviewing the scientific literature. So we're going to talk about that first, and then we'll briefly discuss these other 2 bullet points. So as we think about reviewing the literature, I just want to kind of take a moment to like look at this kind of structure, and it's the relationships of the different types of reviews. And you can see at the bottom, there's individual studies, and there's thousands of individual studies on most any public health topic. So then we look at the next layer up, the narrative review. And narrative reviews, these are like informal, unsystematic, they're pretty subjective methods to collect and interpret information. And they're often summarized subjectively or narratively, telling a story about like a set of research. And they tend to have like less rigorous rules. The reviewer is setting the rules, so it's not necessarily consistent across narrative reviews. So that's narrative reviews. Let's go step up to the green, systematic reviews. So this really aims to provide that exhaustive summary of literature relative to like a specific area, specific research question. And it's, got a set of rigorous rules. It takes a lot of resources. It's a lot of staff time and effort. Within the systematic review kind of layer, there's also like a meta-analysis, and this is a systematic method that like takes the data from a number of independent studies and integrates them using kind of that statistical analysis. And so it really kind of comes up with like quantitative estimate of effect or impact. They might have to gather raw data, gather studies that aren't even published. And this typically is happening with what is known as type 1 kind of research, or research on etiology, or the cause of an outcome. So this is not something that's like, it's not as common in public health, but systematic reviews are definitely common in public health. And then practice guidelines at the top are generated from systematic reviews and meta-analysis. So I kind of just wanted to paint that picture. We're really going to be focusing on systematic reviews. And, you know, that's really to inform public health practice and policy, and, you know, to really help select intervention strategies that are proven, grounded in a good base of the literature. And it really helps also to kind of provide direction for where there's more research and evaluation that needs to happen. So as I say on the slide, into the unknown frontiers of knowledge. But as I mentioned in the previous slide, systematic reviews really are very time intensive. These are reviews that are being conducted by scholars, researchers, a team of them, and there are a number of steps, a number of steps before they even get to like the assessing the results of the literature. But I'll just like call to mind, or call to attention to that, you know, systematic reviews are covering a lot of different studies. They're really not limited to randomized controlled trials. So I think sometimes there's like that misconception about what systematic reviews entail. And systematic reviews, I mean, yes, they're conducted in public health and medicine, but they're done in other areas like advertising and education and zoology. So I think that's important to understand. And then they often include factors other than health indicators. So, you know, you're also looking at like health equity and social cultural approaches to health. And one of the most well-known places to go, or resources for recommendations based off of systematic reviews, is the Community Guide to Preventive Services, or just simply the Community Guide. And so I'm actually curious, so drop in the chat, how many of you are familiar with the Community Guide? Yay or nay? And it's okay if you're not. I'm going to talk about it more. Yeah. Okay. Okay. So some of you are, and it's looking like, okay. And so, well, we're going to dive into it. So the Community Guide, as I mentioned, the recommendations are based off of systematic reviews. This is an initiative that's came out of the Department of Health and Human Services back in 1996. And a fun fact, Ross Brownson was actually, who's involved, he's the principal investigator of the project, and he's actually the person who developed the EVPH framework with colleagues and course, but he was one of the original 15-person panel that began in 1996. So there is some coordination with the CDC, but this is an independent group. There's no federal, it's non-federal oversight, and they're really engaging in this process of reviewing the literature. And it initially started with areas like tobacco, immunization, motor vehicle. It started in those areas to really develop the methods and the approach for the systematic reviews. So, what else? You know, there's a lot more that I could share, and I'm going to touch upon some things, but if you are interested in more of like the methods, I highly recommend checking out, I'll drop the link. Methodology nerds out there. You might be out there. If you're not interested, you can disregard and we'll just keep moving on. But if you're interested, you can take a look at that. So this is a screenshot of the homepage. Let's drop in. I want you to go there. I want you to right now go to the homepage of the community guide, and you can see this is the screenshot. I have the topics listed. There's a bunch of topics. So as you're going to the community guide, I'm going to as well. I'm going to pull up my browsing window, and I actually want you to click on topics, and I want you to find social determinants of health. So, okay. So kind of just scan that. I'm going to keep talking. I know you guys can do more than one thing, so you can listen as I move us along, but you can kind of take a look at any topic, but I will draw your attention to the social determinants of health. So the community guide categorizes levels of evidence, and there's really 3 levels of evidence: recommended, and under recommended there's strong evidence or sufficient evidence, and recommended is really based off of the size of the effect and the number of studies. Insufficient evidence is, I mean, there's just not enough evidence. It's not necessarily bad. It just means that there's more research is needed in order to really make a determination about whether this is going to impact a specific area. So, you know, it's more like interpret as proceed with caution. And then the final one is recommended against due to lack of effect, costs, and harms. So as you are taking a look at the community guide, specific to social determinants of health, why don't you drop in a recommended policy or strategy? There's a whole bunch of them. But if you click on share, so I've got it open and I've clicked on tenant-based housing voucher programs, and this is on the snapshot tab. So you can read at a glance more about what, you know, the intervention is, the finding and rationale. But at a quick glance, you can see that it's recommended and that it's at the sufficient evidence level, and when the systematic review was conducted and the findings were made available. You can click on the other tabs. I'll just call attention to the supporting materials. You can even take a look at the logic model. So lots of good stuff here. Switch back to the slides. I know I'm behind and I kind of need to move along. All right. And then I just want to call attention to some other systematic reviews. There's Cochrane Library. It's a collection of databases that contain different types of high quality independent evidence to inform healthcare decision making. And it now has a public health group. So there's Cochrane Public Health, and I will call your attention to that. And then I just wanted to bring up, there is a kind of a companion guide to the community guide for the clinical side. So there's the clinical preventive services. It was a precursor to the community guide. And of course, this is on the clinical side. So it's looking at clinical interventions. There is a different grading scale, and I could go into that more, but just understand that this is a great tool as well. And it's worth noting, sharing with colleagues, especially those who are on the clinical side of things. Okay, and then I just wanted to call attention as you're searching for evidence there, we focus on the published literature to identify evidence, but we really have to remember that there's a certain bias to what is in the literature, particularly in the case of interventions. Studies with positive findings are more likely to be published than those with negative or null findings. So that's why it's really important to look at other sources for evidence as well. So of course, books, looking at abstracts and even information from scientific meetings, and just recognizing that, of course, there's a time lag for these things. Government reports are a really great source of information. And there was that recent report, this is back in the fall, but the Biden-Harris administration national strategy on hunger, nutrition, and health, that was a really great report. It's definitely worth checking out. So lots of other great sources of information as well. But I just want us to be really good about accessing accessible existing sources to be most efficient. So we want to really start at the top, and the community guide, what works for health, which I'll talk about in a moment, and then Cochrane Public Health. These are great ways to start, because guess what? This is the most synthesized information at the top, and it really is going to reduce time. And these sources really tend to assess the quality of the evidence, really making our jobs easier. Okay, I've talked about the community guide. You've kind of looked at it a little bit. I'm going to skip over this slide, and I'm going to move to what works for health. And I want to make sure that I drop this in the link in the chat. Of course, you're going to have this, but I definitely want you to open up the web page now. So this is a tool of the County Health Rankings and Roadmaps. It's a collaboration between Robert Wood Johnson Foundation and the University of Wisconsin Population Health Institute. I'll just note that they mention evidence informed. So it's providing communities with information to help and select and implement evidence informed programs and policies. So it takes more of a broader array of studies than purely evidence-based. It's definitely a good place to go for newer topics where there's less data or emerging data. And their reviews take into account expert opinion as evidence. So definitely worth checking out. They have a different evidence rating scale. I mean, they have their own process, but it's a 5-level scale. And I'll just drop this in the chat. So scientifically supported. You can disregard the numbers, that doesn't matter. But scientifically supported, some evidence, expert opinion, insufficient evidence. So again, not off limits, not bad, just need more research or evaluation to determine whether or not it's actually helpful. And then evidence of ineffectiveness. I'm breezing through this information. So I just want to point out that the way that the County Health Rankings looks at health and risk factors is somewhat different than the community guide. It looks not only at health outcomes, but also related health factors and what policies or strategies are available to address them. So it further breaks down factors in health behavior, health access, as well as social factors. So Okay, so still on identify policy options. Other ways to identify policies, of course, gathering best practices, including those in other issue areas, and then conducting an environmental scan. So seeing what other jurisdictions have done and the impact that that has had on the community. And I just want to call attention to, like, you don't have to do this alone. We are partners in this process. So if you need some support in kind of gathering other policy actions or conducting an environmental scan, we're here for you to lean on. So I just wanted to point out some resources. These are some great resources. I'm going to really call attention to cityhealth.org. And this is an initiative of the de Beaumont Foundation and Kaiser Permanente. They really they've identified 12 evidence-based policy solutions. They're more upstream, they're more prevention-oriented policies to improve people's health and support communities. Specifically, their initiative is focused on cities. And so they've done some evaluation for the 75 largest cities, I believe, on like these policy areas, so the number and strength of their policies. So they're evaluating that. And they're really supporting these cities in adopting or helping them support them in their adoption of these policy areas. So I definitely would encourage you to take a look at cityhealth.org. And then some of these others are really great in seeing, again, this next one, Smart Growth America, it's a policy inventory. So you can see other communities that have adopted complete streets policies. But like with the Healthy Food Project policy project and Growing Food Connections, you can kind of gather what other jurisdictions or communities have adopted policies, but you can also see the different policy actions related to food, nutrition, food systems, and so forth. And there's some other resources. Again, reach out to us. We're happy to kind of help navigate, what other policies are out there given a certain policy domain or policy area. So, of course, take a moment to introduce yourselves. I think you probably are familiar with some of your colleagues, but you may not be. So take a moment to introduce yourself. Then I want you to briefly discuss and kind of gain consensus on a focus area or issue for improving community health. So I know you had your personal issue that you were thinking through, but I want you to talk about and identify a focus area for your group just in working through these exercises. And then I want you to take a look at those pre-digested sources, like specifically the community guide, the county health rankings and roadmaps, what works for health, and heck, even look at the cityhealth.org. You can see their 12 policy actions. I want you to identify within your group one policy option, maybe two if you're feeling ambitious, but just start with one, okay? So now go out into your breakout groups.
Before going to the breakout groups, Nikki, I have to put you in popular love groups because you are the only one person here from.
Okay, so we've talked about the identification of policy options. We need to actually describe these policy options or the option that you have identified. And please keep in mind that looking at no policy option is also an aspect of policy options. But yeah, so when describing our policy solutions or policy options, we really think about these key questions to answer, which we're going to have you go back in your group and think about these further. And I'm sure you were talking about this to some degree, but really understanding the policy lever. Is it legislative, administrative, regulatory, other? What's the level of government or institution that will implement? How does the policy work or operate? Is it mandatory? Will enforcement be necessary? How is it funded? Who is responsible for administering the policy? What What are the objectives of the policy? What is the legal landscape surrounding the policy? Are there court rulings, or is it, what's the constitutionality? What's the historical context? Has the policy been debated previously? What are the experiences of other jurisdictions? What's the value add of the policy? What are the expected short, intermediate, long-term outcomes? What might be the unintended positive and negative consequences of the policy? So these are kind of the initial set of questions to think about and answer. And then we have these additional questions. Now, you don't have to answer all of these, but, really thinking about the buckets or the criteria in which these questions are housed. So thinking about the public health impact of the policy action, the feasibility from a political standpoint and from an operational standpoint, and then looking at the economic and budget impacts of the policy action. And these three are really critical. If it was, a lot of, in the public health world, we think of like impact and feasibility, but from our research with policymakers, we know that the economic and budget impact is a key element, a really, really key element when thinking through policy options. So let me just scan my notes. I think, when it comes to feasibility, you really want to identify those barriers that will prevent the policy from being developed or adopted at the current time. For such policies, it really may not be worthwhile to spend much time analyzing other factors like budget and economic impact. However, by identifying critical barriers, you are going to be more readily able to identify when they shift and how to act quickly when there is a window of opportunity. So at this time, I actually want you to go back into your breakout groups. I'm going to give you 5 minutes, but I want you to scan those key questions. And actually, we have those key questions in a worksheet, and we can drop it in the chat as well. But I want you to start coming up and describing that policy option that you identified, or policy options. And I want you to also identify from that table, or even the initial set of questions, what's going to take more time and research and just effort in answering? Where do you need support? Who can you turn to? Are there partners that may be able to provide some of that information, that data, that evidence? What kind of support would you want from the PRC perhaps in the process? So go ahead, and we're gonna give you just a short period of time to talk about describing the policy actions and thinking through those key questions.
I'm gonna open the rooms.
A little joke for you, haha. For every complex problem, there is a solution that is simple, neat, and wrong. I don't know if this really applies to your example per se from my perspective, but yeah, in public health, none of our problems are really that simple. And often there are a number of choices that we are having to work through. And our goal is to kind of add some criteria and add some objectivity to the process of prioritization. So let's talk prioritizing public health issues at the community level. And here are common elements of the criteria. I think these really come out in the 3 that were already identified as part of the CDC's policy analytical framework prioritization table, that table where it was talking about public health impact, feasibility, and the economic and budget impact. So these elements, we're talking about, the measure of burden, illness, death, years of life lost, so getting at quality of life and being able to quantify preventability. Of course, we need resources to be able to carry out the policy or intervention, and of course, gathering and getting community input and involving the community in decision-making all along the way, which we've talked about. I wanted to share this framework. This is from Multnomah County, Oregon. And the model really suggests that when we're making decisions, we want to use and center equity and empowerment, and to remind us that the main goal of public health is social justice, and that people in our community deserve to be able to lead the best life possible, regardless of who they are, where they live, and where they fall on the continuum of power. So, you know, we've talked about elements of these boxes, or they've been included in, some of them have been included in the previous slide, but they really help us figure out how to get there as we make decisions. So thinking through who's impacted positively or negatively, who's facing, what groups are facing what barriers, what processes do we currently have in place that include or exclude certain groups, and so forth. And this slide just has a summary of key steps in the prioritizations process. So, of course, getting on the same page about criteria. I know I've laid out, and the CDC laid out those three main buckets of criteria, but you might have something additionally. And the need to form a team or advisory group and really having strong leadership among that group. Gathering evidence, data, information as part of that process, establishing some sort of stakeholder input review, and absolutely including community members with lived experience in that process. And really going back to that equity and empowerment lens developed by Multnomah County, Oregon, is reminding us that, you know, that process is a series of actions and steps, and connecting to process means you're continually refining engagement and relationship building in order to be more inclusive, respectful, and aware. And that within equity work, how we do something is just as important as what is being done and why. So that process, the how we're engaging and bringing in folks, is just as important as that end goal. And of course, being transparent about and communicating the prioritization process to stakeholders. Group decision-making, I feel like this is how it works. We've got to be doing group decision-making, and just, you know, recognizing that there are disadvantages, and the advantages by far outweigh the disadvantages, but recognizing that the process is going to take longer, and there might be aspects of compromise or indecisiveness to work through, and you know, these other aspects to keep in mind, but recognizing that you know, we can refine and work through those challenges together. And in that process, we can learn a lot and actually strengthen our work together as a collective. You're going to be receiving this handout. This is from the CDC Policy Analytical Framework. So as your group identified and began to describe some policy solutions or the policy solution, then you would assess the policy option independently against criteria. And in the case of you all, I know there was one policy option that you're really focused on. You would look at that policy option, and then you would look at no policy option, like if we did nothing. So understand that that is the comparison in perhaps your case. You want to be sure to, so you'll be engaging in the rating, and you might consider how to best quantify the rankings. I know here we have like low, medium, high, but you might be able to actually break that down. Maybe you have access to some data, like on the economic and budget impact side in particular, like you might be able to actually include like what's the number of lives saved, and kind of breaking that down, or what is the return on investment. I think it's really helpful to document the evidence, data, or reasoning that you and other folks are using as you assign the rating in each, in a separate matrix. You, of course, are evaluating the policy options against other, based on the ratings of your group and team that they assigned. And you're going to prioritize those policy options. And really the criteria are not intended to be examined in isolation. So you're going to prioritize, well, I should say, like the policies that you're prioritizing will really depend on the weight you place on the 3 criteria, or the X number of criteria that you have in the overall analysis. And if your policy is not ready for now, prime time, because of low feasibility or insufficient data, insufficient stakeholder input, perhaps, there may be other steps that you can take. So, I don't, like, it might be that you're considering more incremental policy to address the problem or issue. That seems like that might resonate with your particular issue, but sometimes it's like there's not enough evidence or data. And so your policy research agenda might be identifying the key questions that need to be addressed. Okay, so let's talk strategy, because you've prioritized your policy solution, and now you need to define the strategy for getting the policy enacted and implemented. And this process may include identifying how the policy will operate, what steps are needed for policy implementation, as well as considering like other factors or assistance for those that will be adopting the policy. So that's an aspect that could be formulated. But more often than not, it's really identifying and educating and informing stakeholders and sharing relevant information. Perhaps it's conducting some additional analyses, but you and others have done a lot of work gathering information, evidence to understand and define your issue. And if you've gone through this process of conducting the policy analysis, you've got all this information. You just want to think through how best to share the results of the policy analysis. What aspects are relevant to which stakeholders and in what form? And so before we kind of go down that rabbit hole, I want to talk a little bit more broadly about strategy and introduce this framework, the Advocacy Strategy Framework. And this is for the Center for Evaluation Innovation. And this framework is organized around 2 main dimensions of advocacy strategy: the audiences targeted down here below, and then on the y-axis, the changes desired with those audiences. So the audiences are the individuals and groups that advocacy strategies target and attempt to influence or persuade. And these are the main actors in the policy process, and it includes the public or segments of it, policy influencers like media, community leaders, the business community, thought leaders, other advocacy organizations, and decision makers. So the elected officials, CEOs, or other administrators. And just note, strategies may focus on just one audience, or they could target more than one simultaneously. And then on the y-axis, the changes, these are the results an advocacy effort aims for with audiences to progress toward a policy goal. So, it's starting with basic awareness or knowledge. And then the next point is will, the goal to raise an audience's willingness to take action on an issue, trying to convince the audience that the issue is important enough to have action and that any action taken will actually, in fact, make a difference. And then the third point is action. So support or a way to facilitate audience action on the issue. And within this framework are specific types of advocacy tactics. So these are the tactics here that can be used to achieve policy goals. And really your first step is to think through how the strategy is positioned. So which audiences need to be targeted? The public, policy influencers, and or decision makers. Who needs to advance the policy goal? Who needs to be targeted? And some issues, it's going to be through like targeted work with policymakers and key influencers without like little engagement of the public. Other issues, you might need to actually engage the public, especially those that require a popular vote, like that's put on a ballot. So which audience needs to be targeted and what do you want to accomplish with each audience in order to achieve the policy goal? So with like issues that are brand new, the problems to be addressed have not been clearly documented and audiences are unaware of the problem's importance. Others are known, like tobacco, but they lack a sense of urgency and importance in the policy arena. And still others just may be stuck. So maybe the evidence documenting existing problems is insufficient or unconvincing. Issues may be like deep rooted. The solutions may seem unfeasible, so on. So because policy issues are at different points, determining where audiences stand now, along with how far they need to move in order to achieve a policy goal is essential. And you must think through that. Who specifically is the strategy trying to influence and how? So we talked about these three buckets and the framework, encourages specific consideration of who is being targeted, specify who within those categories really needs to be targeted, what segments of the public, which policy influencer groups or individuals, which decision makers, because you really need to get specific. Effective communication efforts requires tailoring messages to audiences. I would love to give you a pause to do that. You guys have a really great engaged coalition. I think this would be an excellent topic of conversation, if that hasn't already occurred, to identify the specific facets of these three audiences. Who else is working on this and how? So yes, you want to identify your key audiences, who you want to move. You need to know who are the players, who are the actors in this space, who else is working on this and how are they working on it? So you're going to outline potential supporters. Yes, of course, I have a tendency to think of supporters first, but you want to outline opponents, and maybe that is at the forefront of your mind, and everyone in between. So that's where you will need to guide your efforts. It's going to help you focus those efforts. So assessing the positions of these stakeholders and the strength of their support or opposition will help you in channeling those resources wisely. Again, this is a great opportunity for a coalition meeting. Again, we're getting close on time. I will be sticking around after this workshop to answer any questions. And I'm just available in general. I'm a connector for our team. But having a coalition meeting to brainstorm and really fill in the chart is really a great way to get everyone's thinking and input for all to see, because we each are going to bring it a slightly different perspective, and may have, we can open each other's minds into who is really in this space and who can really work with us or work with you on this endeavor, or who's opposing this. Unlikely champions, fostering champions. This is also an opportunity. So we conducted a social network analysis with your the key actors in your community health. Look at that network analysis. See who has identified, who's rated themselves as influential in the policymaking process. It'll be good to have those folks at the meeting to discuss this. But looking at who's in your network, who's not in your network. So that's another facet to think about. Another piece of evidence, I should say, that you can use as you're developing your strategy. Okay, so policy, we've got to think long game. It's going to take a long time to achieve a policy goal. Sometimes it won't, but typically it's going to take a long time to achieve a policy goal. But sometimes there are those sudden windows of opportunity that might open that no one could have anticipated, and it speeds the process along. You're going to need to think about how strategies will need to change over time to meet the environment. The ever-changing environment, and there's shifting. There's new elected officials. There's a shift in public opinion, and maybe that has something to do with your efforts. Maybe there's a crisis that came up, or there's unexpected opposition. So your strategies are going to need to occur in phases. So it's going to be important to revisit over time. And given the many factors that might affect policy change, it's important to assess advocacy effort for more than just its ability to achieve a particular policy goal. We've got to have those wins along the way, or to be able to track if we're having wins, if what we're doing is actually moving us along in that direction. So there are these larger set of interim outcomes that we can keep in mind to help us build and sustain influence in that policy process. So, for example, in addition to interacting directly with policymakers, you might further build your coalition or build another coalition, I don't know, or group. Develop high-profile political champions that increase ability to move policy issues. Or your strategy might aim to develop a network of community-based advocates to become active grassroots voices. So these are all milestones along the way. And I shared this is again straight from the Center for Evaluation Innovation, the Advocacy Strategy Framework, to help you think through those wins along the way in the policy process. Okay, so we're getting close to time. Again, I'm going to stick around if you have questions or just want to bounce around some ideas. It's really our hope that this workshop has guided you toward and gotten you maybe a little excited or eager to dive into strategic communications, which is an upcoming workshop. But this back work needs to happen before you just dive into, we're going to create some messages, because guess what? In order to communicate effectively, we need to identify our audiences. It needs to make sense. But yeah, being able to communicate effectively is at the heart of effective engagement and advocacy. And I know I say the advocacy word, and advocacy, the A word is kind of like, ooh, I don't know. And also the L word, lobbying. Those can be kind of, I don't know. I don't want to say scary, but just like, I can't do that. I can't do that. So that's why our next workshop, our very next workshop, and I'm going to take us to that, is really about demystifying advocacy, because you probably already know this, but you're engaging in advocacy by engaging in coalition building. That's one aspect. But next workshop, which is Thursday, August 17th, that's really demystifying advocacy and really defining what is lobbying, what is advocacy, and what you can do as a community practitioner, because you very much have expertise that should be lent to decision makers. You need to be engaging in that process, and being able to understand what you can and cannot do. The parameters around that is helpful. And maybe you just use different words if you don't want to use advocacy. I engage, I educate. And then after that workshop, we've got the intro to media advocacy, specifically more so strategic communications, getting at messaging. So those are coming up, and I want you to take part in those. But yeah, this concludes our workshop. Please connect with us, contact me with any questions, or if you need more information. And I'm kind of that gatekeeper or connector to other folks who can be a resource to you if I or our team specifically cannot. But thank you all. Thank you all for joining. This concludes the workshop.